Hello everybody. Today is Saturday, June 18th, 2022. My name is Tran and I'm glad you're able to join me today. I wanted to share with you my experience and journey with pancreatic cancer. It's been a couple weeks since I provided an update on where my progress is with this disease. I had met with the team at NIH this past week where we had ran some blood work and also did a brain MRI to see where things are at with the tumor. And the good news is that the tumor has not spread to my brain. The downside, however, was my hepatic numbers for liver functions were all spiked and elevated, and I've even had started to experience some jaundice and the yellowing around my eyes and underneath my tongue. So based off those results, the team at NIH, we decided that the clinical trial that I was pursuing with the T-cell receptor was not going to be available to me at this time until I get the numbers down to a normal level for my liver function. They did, however, suggest that I have a stent installed in my pancreas to help with the bile fluids, which was causing most of the jaundice condition that I was starting to experience. So on Thursday this past week, I had that procedure done where the doctor went in with an endoscope and installed a covered stent that's temporary. I didn't want to have a metal stent that was going to be a permanent, just to give me some options down the road. So that was done on Thursday, and today being Saturday, it's been 2 days. I think the procedure was successful. I didn't have any negative reaction to it. I'm starting to feel that the bile is starting to run its normal course now through the body as a result of the stent that was installed. And the only other thing that I would say is my pain level has still been relatively consistent, maybe elevated on a daily basis, where I am taking a little bit more of the immediate release morphine and that help with my pain management, specifically around my back, my lower back, and my pelvis area. The two pelvis areas on my side seems to be weaker. I have lost significant amount of weight. I am down to about 125 pounds that I weighed myself this morning, and I continue to try to force myself to eat a little bit at a time, but needless to say, I am eating, and hopefully my appetite will regain its normal course in due time. I mentioned, I believe in my last video, where I was trying liquid oxygen, and I'm not sure if that was helping me or not. The jury is still out on that. I suspect that it had some influence with the elevated hepatic numbers for my liver function, possibly irritating the pancreas and inflaming the pancreas to close the bile ducts. Although I would say that my CA19 numbers were lower, surprisingly, when I did my blood draw this past week at NIH. And I'm not sure if that was associated with the liquid oxygen. So at this point in time, I'm still cautiously optimistic about using liquid oxygen. I would suggest that you talk to your medical team about any use of that. I am at a point where I have nothing to lose, I feel like, so I possibly will continue to use it, maybe at a lower dosage than before, dosage being drops that I would put in water. And other than that, I'm still just fighting through the pain on a daily basis. My energy level has continued to diminish, so nothing's changed there. And my back, again, is, I think, is weakening every day as a result of the tumor metastasizing in the bones, particularly the L2 vertebrae. So the next steps for me at this point is to talk to my oncologist to see about going back to a previous chemo treatment and trying something that maybe slow or stop the continued growth and metastasized tumor to other parts of the body. If you have any questions, I'd be more than happy to kind of look at those underneath. If you leave me comments or questions, I'll take a look at it as best as I can and respond to you accordingly. I do appreciate you joining me today, and I wish you all the best in your journey with pancreatic cancer, or with somebody you may know who's going through the same journey. Thank you again, and have a great day, VTL, and I hope to talk to you again soon. Take care, and goodbye.